We're delighted that you've chosen Mercy San Juan Hospital for your upcoming spine surgery. Our staff is dedicated to making you feel at home by providing you with the most innovative and compassionate surgical care available today. The purpose of this program is to supplement the information you received in your pre-surgery information packet. We hope this information will make you feel more at ease by providing you with accurate expectations about your surgery, your hospital stay, and your subsequent recovery. We encourage you to share this video and your surgery information packet with your family and friends that are assisting you after surgery. Our patients have found that both resources are helpful for answering questions or concerns as they arise. There are several steps that you can take so that your surgery, hospital stay, and transition home is smooth and successful. Planning ahead and preparing your home will help you experience a smooth recovery after your spine surgery. You'll appreciate later on the time that you took to do these things now before your surgery. Remove all fall and tripping hazards such as small area rugs, pet toys, extension cords, and loose carpets. Install night lights in dark hallways. Arrange furniture to allow for at least 3 feet of space in walkways. You will also have lifting, twisting, and bending precautions, so arrange your environment so everyday items are handy. Do not put items too high or too low. For the time being, consider placing commonly used items like plates and glassware at countertop level. If you live alone, make arrangements to have some help, especially during the night for at least the first few days after you return home from the hospital. It's a good idea to have someone at home to help cook, do laundry, and grocery shop. Pack a small bag with loose-fitting clothing, non-skid shoes with backs, and a light robe that you can wear while exercising and walking around the hospital. Shorts or loose cotton pants or sweats without elastic at the ankle work well. Please bring your glasses or contact lenses with case and solution, your dentures, hearing aids, toiletries, insurance card, a photo ID, a detailed list of your medication, a credit card or check if you need to make a copayment, and a copy of your advance directive for health care if you have one. The Advance Directive document is a way for you to communicate your wishes about your health care should you become unable to speak for yourself. It also allows you to appoint someone to speak for you and make decisions on your behalf. Feel free to bring your cell phone and your favorite pillow as well. If your surgeon has instructed you to get a neck brace or back brace, please bring these with you to the hospital. Please do not bring any jewelry, large amounts of cash, keys, or walking aids such as canes, crutches, or a walker. The hospital will supply you with any walking aids that are needed. Expect a call at least 48 hours prior to your surgery from the pre-admitting nurse from the hospital. This nurse will review your medical history, confirm the date and time of your surgery, and remind you when to arrive at the hospital. It's important to arrive 2 to 2.5 hours before surgery. This early arrival is required because one of the antibiotics we give you before surgery to reduce the risk of infection takes an hour to infuse. The nurse will also review your medications and any dietary supplements or herbs you are currently using. There are some medications that you will be asked to take on the morning of surgery with a small sip of water. There may also be some medications that you will be asked to stop using prior to your surgery. You can have solid food up to 8 hours before your surgery, and clear liquids such as coffee, without creamer or sugar, tea, apple juice, and water can be used to hydrate without restriction up to 3 hours before surgery. If you should develop a fever, cold, or flu symptoms in the days leading up to your surgery, please let your surgeon know immediately, since your surgery may need to be rescheduled. You will be given a pre-surgical preparation packet to use at home the night before and the morning of your surgery. Please follow the instructions included in the packet. On the day of surgery, remember to take any medications you were told to take with just a sip of water to get them down. No need for any makeup, hairspray, or hair gel. We want you to be as natural as can be for the surgery process. During your phone call with the pre-admission nurse, you will be given instructions regarding what time to arrive at the hospital, as well as the entry location. Most surgery patients will come in through the main lobby and check in with the information desk. After that, they'll go to admitting to sign paperwork if needed and get their hospital ID band. You'll be given whatever directions you need, and there are signs to point the way. 1 or 2 family members are allowed to stay with you while you are in the pre-surgery area. You will have an intravenous line that will be used to give you fluids to keep you from getting dehydrated or low on fluid, and antibiotics to reduce the risk of infection. Your surgeon, anesthesiologist, and operating room nurse will introduce themselves to you before surgery and answer any questions you may have. The duration of your surgery will vary depending on the type of surgery you will be having. Your surgeon will advise you of the estimated time in surgery during your preoperative visit. Your anesthesiologist will discuss the type of anesthesia that's best for you. You will be asked to provide your name, date of birth, and type of surgery many times during your stay. In fact, before you even enter the surgery room, we will either mark the site of surgery directly on your body or place a wristband on you that identifies the procedure and location very specifically. We do this to provide the utmost care and safety for you. We want to ensure your visitors are comfortable while they wait for your surgical procedure to be completed. We have a waiting area right outside the surgery department on the floor, and a chapel off the main lobby just a few steps from the information desk. Please feel free to leave your cell phone number with the volunteers located at the desk in the main lobby if you would like to be called once the surgery is complete. Once the surgery is finished, you'll be transferred to the recovery room where a nurse will closely monitor you for about 1 to 2 hours. Don't be surprised when you hear the beeping of the blood pressure monitor and feel a small tube in your nose that delivers oxygen. You may notice a monitor on your fingertip as well that measures the oxygen in your blood, and squeezes being applied to the calf of each leg by a sequential compression device that prevents blood clots from forming in your legs. There may be a tube exiting from your dressing that drains a small amount of excess blood from your incision. After the recovery room, you will be transported to the surgical floor. With today's less invasive surgical procedures and rapid recovery rehabilitation protocols, you can expect to stay from 1 to 3 nights in the hospital depending on your particular procedure. While this may seem quick, most patients can walk and get up and get out of a chair as well as go up and down stairs within this time frame. Each room at the hospital is equipped with free cable TV and Wi-Fi. At Mercy San Juan, we have a special service called Condition Help. Condition Help was created to address the needs of patients or their family members in case of an emergency and you are unable to get the attention of a healthcare provider. Simply dial 0 from your hospital room telephone and request immediate help. The Condition Help information and phone number is posted in every patient room. For less urgent but still important needs, please use your nurse call light. We also provide the cell phone number of your nurse, charge nurse, and department manager on the whiteboard in your room. We want your experience at Mercy San Juan Hospital to meet all of your expectations. If at any time we are not meeting your needs, please let us know. We want to do everything possible to ensure your comfort. Pain control. We are committed to managing your pain safely. You will be monitored very closely if you are receiving any opioid, narcotic medications by IV. Our goal is to transition you to oral medications for pain as soon as possible and to use the least amount of opioids as possible. Typical opioids we use are morphine, Dilaudid, fentanyl, Norco, Vicodin, and Percocet. Multimodal pain management is the practice of using different types of treatments to manage pain. You may be offered ice and repositioning to help with comfort. We may offer medications such as Tylenol or muscle relaxers to help with pain. Moving may seem like the last thing you want to do when you're in pain, but it can help to sit, walk, and gently stretch. Other ways to manage pain include distraction, like listening to music, watching a movie, a puzzle book, or a visit from a therapy dog. Ask your nurse for help with some of these items. Opioid safety. Take only the amount of pain medication that is prescribed by your doctor. Keep track on a notepad or calendar how frequently and at what time you are taking your pain medication. Do not mix alcohol or sedating medications such as Valium, Ativan, or Xanax with opioids. Take the least amount of opioid medication that you need in order to make the pain tolerable. Try other techniques such as ice, distraction, relaxation, etc. Take non-opioid medications such as Tylenol to help manage pain. Please note that Norco, Vicodin, and Percocet have Tylenol in them. Never take more than 3,000 to 4,000 milligrams per day. Post-operative prescriptions. Recent California legislation may have an impact on the amount of pain medication that can be prescribed when you go home. Most patients will only receive a 7-day supply of opioids after discharge. This may require you to notify your surgeon after your first week at home for a second prescription if you are still having pain. Some pharmacies require all opioids to be sent by e-prescriptions. Check with your pharmacy and let your surgeon know if this is the case. Some pharmacies can only dispense a set amount of opioids per person per day. And some insurance companies need a pre-authorization before a prescription is filled. California state law limits the amount of opioid medication that can be dispensed. In California, the maximum allotment is a 7-day supply. Insurance authorization is required and may impact your ability to fill a prescription based on plan requirements and other factors, dosing and amount of pills prescribed. Please communicate any issues you're experiencing with filling your prescription with your surgeon as soon as possible. As soon as you feel comfortable after surgery, you can resume drinking and eating. We will begin your diet with ice chips and then progress to clear liquids and solid foods as you tolerate. It's important that you are given food that you like to eat. Even though there is a daily menu, you will find an assortment of alternative items that you can choose from. Just call the dietary department using the phone number listed on the menu to let them know what you prefer. You will recover faster and feel better if you eat your meals when sitting in a chair rather than lying in bed. Once you are comfortable drinking liquids and eating food, you can start taking pain pills and the IV pain medication can be decreased and discontinued. Avoiding infection begins with the administration of antibiotics in the preoperative area. These antibiotics are then continued for about 24 hours after surgery. In addition, all healthcare workers and guests should either wash their hands with soap and water or use a sanitizing gel or foam whenever they visit your room. And gloves will be worn by those caring for you for most procedures, especially when your blood is drawn, your IV is started, or your dressing is changed. Activities and rehabilitation. After your spine surgery, you will be encouraged to be as active as possible. A quick resumption of activity greatly lowers the risk of post-operative complications such as blood clots, pneumonia, bed sores, and urinary tract infections. As you progress through your recovery, you'll learn movement techniques and exercises recommended for your particular type of surgery. Your nurse and therapist will develop a care plan specifically designed for you, and they'll provide you with appropriate information on precautions, equipment, needs, and exercise. Depending on the type of surgery you have, your doctor may prescribe a neck collar, back brace, abdominal binder, or other type of equipment. Your nurse and therapist will explain how to use these devices. In order to prevent complications while in the hospital, you should move side to side every 2 hours. Take several deep breaths and cough every hour while you're awake, and bend your knees and ankles up and down 4 to 5 times every 2 hours. You'll also be encouraged to get out of bed and use the bathroom rather than a bedpan. However, to avoid falls, please be sure to always have someone accompany you to and from the bathroom until the doctor or nurse give you the okay to go by yourself.
Here's your call light, so when you're done using the toilet, you can push this and I'll come right back in, okay?
The typical hospital stay for spine surgery varies from 1 to 3 nights, depending on your condition and the procedure you had. When you get in and out of a chair, walk, climb up and down stairs, and tolerate oral pain medication, then you are ready to go home from the hospital.
Here's your packet for home instructions that we'll go over. So here it says that your doctor wants you to follow up in 2 weeks. Okay, there's this contact information.
The nurse will go over some written instructions outlining the general precautions you should take. The hospital pharmacy will fill any after-surgery prescriptions that have been ordered for you, including pain medications, so you'll have them before you go home. The nurse will go over the medications so that you are familiar with what they do and when to take them. If you have any questions at all about your medications, please ask your nurse or the hospital pharmacist to explain them to your satisfaction. You'll need to arrange to have someone drive you home from the hospital since the recent surgery and use of pain medication prevents you from driving yourself. Please note that the discharge time may be early in the morning and you'll need to make sure that whoever is driving you home is there before 11 a.m. on your day of discharge. You may not take a taxi or a bus unless you have a responsible adult family member or friend to accompany you. Before you leave for home, you and your family can look forward to working with our case manager, who is an RN with a special knowledge about your surgery, what is needed during your recuperation, and the types of resources that are available in the community to help you get back on your feet. Your hospital therapists, in conjunction with your surgeon, have developed a care plan that is tailor-made for you. Your care instructions should be followed diligently until your doctor gives you the clearance to discontinue them. Depending on the type of spine surgery you have, you may have 1 or more surgical incisions. Incisions will be closed with sutures, staples, paper tape, or skin glue. Some sutures are self-dissolving and do not require removal. Removable sutures and staples will be taken out at your first post-operative appointment, about 10 to 12 days after surgery. Paper tape will fall off slowly by itself or be removed in the doctor's office. Skin glue will fall off by itself in 5 to 10 days. Your incision does not require much care once you leave the hospital. If you have a small amount of drainage, then you can change your dressing daily until it stops. Once the drainage stops, then whether or not you cover the incision with a dressing is up to you and your surgeon. If drainage soaks your dressing to the point that it needs to be changed more than twice a day, then you should let your surgeon know. Another reason to call your surgeon is if you develop a fever greater than 101 degrees or if the incision becomes red, swollen, hot, or painful. Be sure to discuss showering and bathing with your surgeon. Most surgeons agree that you shouldn't soak your incision in the bath. Do not put antibiotic ointment on the incision. Do not use cleaning agents such as peroxide or betadine on the incision unless specifically instructed by your surgeon. Do not use lotions, powders, or oils on your incision until the incision is dry. Your surgeon will prescribe pain pills for you to take at home. Sometimes side effects such as fatigue, dry mouth, and constipation may occur. However, your need for pain relief will subside over time and the side effects will go away. If pain persists, please contact your doctor. Keep a glass of water and pain pills next to your bed in case you wake up sore in the middle of the night. Anesthesia, decreased physical activity, dehydration, pain medications, and a change in eating habits all increase the likelihood of constipation in spine surgery patients. Drinking extra fluids, increasing the fiber in your diet, and using over-the-counter remedies like Metamucil or Citracel, or taking a stool softener such as Colace should help. Patients undergoing surgery can be at risk for blood clots due to loss of mobility or the effects of anesthesia. The more complicated your surgery, the greater the risk of blood clots forming. Based on your procedure and your medical history, your surgeon may recommend that steps be taken to avoid blood clots, such as taking special medicines or having garments applied to your legs to promote proper blood circulation. Walking, leg exercises, and resuming activities are also good ways to help avoid developing blood clots. Let your surgeon know if you have a sudden increase in leg swelling or a new pain in your leg that does not go away. Resuming activities. You can resume activities based on how you feel and your surgeon's instructions. For all types of spine surgery patients, remember no BLT. This means no bending, no lifting more than 10 pounds, and no twisting at the waist. When getting in and out of bed, remember to use the log roll technique that you will be taught while in the hospital. Roll to the side in a log position, keeping your shoulders and hips in alignment, being careful to maintain proper spinal precautions. Once you are on your side, drop your legs off the side of the bed and use your arms to push your upper body off the bed and into a seated position. Be mindful to sit at the edge of the bed for a moment before standing, allowing your blood pressure to stabilize to prevent lightheadedness. Here are some general precautions you should follow until your doctor gives you clearance to do more. No housework, including making the bed. Do not sit for more than 15 to 20 minutes at a time. Do not shower or bathe, and do not drive or ride in a car. However, it is okay to ride home from the hospital and to go see your doctor. No sexual intercourse. Don't start a new exercise program, but it is okay to begin taking short walks and increase your activity level a little each day as fatigue and pain permit. Use a reaching tool to get items off the floor. Remember, no bending. Change positions frequently as directed by your doctor. When sitting, use a firm, comfortable chair with armrests. Do not sit on low or very soft chairs. Putting a pillow between your knees may help make it easier for you to sleep on your side. Before getting out of bed, pump your ankles and bend your knees up and down about 10 times. This will help prevent swelling and pooling of blood in your legs. If you have one leg that is stronger than the other one, go up stairs and curbs using the stronger leg first. Go down with the weaker one first. This will ensure that you're always being supported by the strongest leg as you go up or down. If you use a walker when you return home, stand straight, look up, and keep your bottom tucked under you. Do not twist your body to turn. Instead, move your feet and body together as you turn gradually. And as you gain strength, you can build more endurance by making short, frequent walks. The message is, don't be afraid to get up and move. Each week, you should be walking further and resuming more activities than the week before. We want to thank you once again for choosing Mercy San Juan Hospital for your upcoming spine surgery. We hope that you will feel at home during your stay, and it is our commitment to provide you with the most innovative and compassionate surgical care available today.